to slow progress in the fight against HIV, TB, and malaria. So that work is a U.S. priority, remains a U.S. priority, and there's far more work to be done. Second, we know that the Global Fund works. It has a proven track record of driving impact and saving lives. It has been a reliable and essential partner in times of crisis. We've seen the Global Fund most recently do this for Ukraine and the humanitarian disaster that is taking place there now. They're mobilizing resources for Ukraine. They've done this for the COVID response through the what they call the C19RM COVID mechanism. They've done this in the past as well for Mozambique, for assistance there related to the natural disasters, and for Afghanistan. The list goes on. And so they drive impact and they save lives. The third reason is actually the title of this panel. I loved when I saw the panel title, A Foundation for Equity. We know that's what the Global Fund does. It's a vehicle to advance equity, human rights, and to build strong health systems in partnership with countries and communities. We know that is what you need to respond to not only the threats of today, but the threats of tomorrow. So these are the reasons why we're activated to support the Global Fund and the replenishment in particular. And as you said, the $18 billion replenishment goal, that is an at least amount that we're committed to. And that's the only way that we're going to be able to be on track to meet the SDG goals of 2030. Anything less will be failure. And as you said, President Biden, in his budget request earlier this year, included $2 billion for the FY23 amount, and that was in big part to the support and the grassroots organizations working to ask for that, and for the support that you guys generated from members of Congress. And then more importantly, there was an intent to pledge up to $6 billion in that amount. But that can only be realized if the Global Fund raises $12 billion from other donors. Otherwise, they're leaving money at the table because of the matching requirement. So in your advocacy and in your work with governments and with other donors, that is a powerful message to say, don't leave money at the table. We need to raise $12 billion to get the $6 billion from the US and get to that at least $18 billion amount. So that's the work ahead.
Yeah, thanks so much. And thanks for the reminder also about, because it didn't come up yet in our conversations today, the reminder about the Global Fund's role in both long-term, but also how it's been able to respond to some of these acute emergencies, because that is really critical as well. You were talking about our partners and how they can use that leverage of the U.S. matching pledge. They are engaged with their governments around the world, and we've also just gotten a question kind of from the U.S. side. Could you talk a little bit more about, as our partners are engaging their government, even as our U.S. folks are thinking about ways to ask members of Congress for relationships they have to kind of push like allies and other governments to step up, the kind of things that the administration is doing, will be doing, to also leverage its pledge. So anything more you want to say about G7 or, sort of other places where the U.S. is reaching out bilaterally? I mean, I know you can't necessarily talk about all the details, but.
Yeah, no, we can't talk about the details, but happy to share what we're doing. And it's a lot, and we need help, because the U.S. alone can't do this. And it really does take a community and a village of supporters. And this is why I'm here on a Saturday to join you all, because I know, as I said, the power of your work. And so we are targeting, as Joanne said, the G7 countries. These are the European countries in particular, and the European Commission itself. We want all those governments to provide at least a 30% increase in their pledge. That is our main message with all donors. But we're also expanding and working with other governments to expand the Global Fund's donor base to drive new donors into their family of donors. And we're doing this in various ways. Last week we did an event with GFAN, for example, in Berlin, with our U.S. ambassador in Berlin. We're doing events in London. So we're working with grassroots organizations in capitals, with our embassies in different capitals, to help drive the message of why the Global Fund replenishment is so important. Our U.S. ambassadors all around the world have been ambassadors for this work. And we're grateful to them for their leadership. Our own leadership in government have been doing messaging around the Global Fund in their engagements at the G7. Last May, a couple of weeks ago, actually, there was a very important ministerial meeting that took place at the G7 with health and finance ministers, and I know that you all were activated ahead of that. But we got a win there too. We got some really important language in the G7 development communique, and whether it's a very policy wonky thing to say that we got 3 lines in a policy document, but guess what? Donors read that, and it's a commitment that they sign on to. And so that was very important. And we're doing that again ahead of the final G7 meeting, which is later this month in June. We want strong language in that final G7 communique that comes from heads of state around the Global Fund replenishment. And so that's what we're doing. And we're also working with our embassies in Washington and New York and Geneva. And so where you have grassroots contingency, to mobilize around those cities, but also in donor cities to match our work or do work together. I think that's where we can amplify each other's power.
That's great and really, really helpful, and really appreciate the US's leadership and push. Again, as you say, the G7 communiques can be kind of wonky, but when they say actually that we should increase the funding by 30%, it matters. And I really appreciate the US's leadership in pushing on that. You have played a lot of roles, including key roles, on the Hill. So just for our folks, we will have people are doing and in our partner countries too. Our Canadian partners just came off a big mobilization around the Global Fund, but our U.S. folks will be coming. We'll have a fly-in with a subset of folks coming in about a week and going on to the Hill, and just say a little bit about. From your own perspective, just a reminder, and especially for folks who are newer to this, like why it matters, why that kind of support matters. And then also both the short term in this moment, pushing to do all the creative things we can on the Global Fund, but also longer term in terms of building the kind of bipartisan support we've had on this issue for a couple of decades.
Yeah, it's a really good question. We can't take any of it for granted, right? There's so much happening in the world. It feels like the whole world is on fire with climate change, with war, with the hunger crisis now that's developing. There's a lot, and even within global health, we have a lot of priorities that we need to lead and to mobilize resources for. So. I think this advocacy work is more important than ever, and the work we're doing around the Global Fund is a part of that. But there's so much more that we all need to be working toward. And when I was a Hill staffer a long time ago, I actually was in. My job was to actually receive the emails and the letters that were sent in, and sometimes I'd even have time to pick up the phone and hear from results activists. I remember in California, Northern California, if there's any Northern California in the house, you guys were very, very active with op-eds and letters to the editor, I remember. And it was my job to brief the Congresswoman, and this was Congresswoman Barbara Lee, and to let her know what her constituents were saying around these topics. And that gives her power to do what she does, and that's true for her, who she's already a leader on these issues, but for all members of Congress, when they hear from their constituency, they're just empowered to act on things. And sometimes it takes time, and it can be frustrating because you write a letter, you don't get a response, but it just means you need 100 more letters, you need 100 more phone calls, and that really does make a difference. As I said, I was the one who was developing the response for the Congresswoman to look at and to react to. So that works, and we need to do that now, because it's very easy for the world's attention, for Congress's attention, to be on other matters, other important matters, and we know they should be doing all of them. And so if we don't do our work to drive advocacy and attention on global health issues, and in particular the Global Fund replenishment, PEPFAR reauthorization next year, all of these issues will not get the priority that they need unless we drive that for them.
Yeah, thanks a lot on that. And we still
I see in the chat, Sue. Yes, exactly. I see some activists commenting from Northern California. Absolutely,
yeah. We've been appreciated your partnership for a long time as well. And we still do have time for some questions. So if folks do have questions, and I have one other, maybe a little more personal. You've worked on these issues on HIV/AIDS and other health issues from a variety of perspectives. Through really challenging times and with tons of really hard work and commitment. Could you just talk about, a little bit of both what inspires you, but also even in the almost more challenging times, like what keeps you going, a little bit of why you got into this work, why it matters to you.
Oof, yeah, well, thanks. That's a tough one. I think what inspires me is really people, and when it's been nice to get back on the road a little bit in my role as so I work at PEPFAR now, as Joanne said earlier, and we support programming all across the world, and in particular in sub-Saharan Africa. And so I had a trip recently to South Africa where I was able to see firsthand the PEPFAR program there, and as well as how it works with the Global Fund program there. The Global Fund grant just got renewed in South Africa. And people are coming. When I say people inspire me, it's because I've seen the resilience that people have had just fighting COVID in their communities, in their church, in their networks, in their just neighborhoods, within their families, but they haven't. But they continue to bring innovation and ideas to the work for the HIV response and for the TB response. I was visiting HIV and TB programs in South Africa, and people have some very creative strategies to bring people into care, to get multi-month dispensing for people who needed their antiretroviral medications for HIV. And now what we're seeing is that with COVID restrictions loosening, although COVID is still real and we still need to be protecting ourselves, but as people are engaging more out with communities and with programs, we're seeing that creativity translate into programming. And I've seen a lot of energy across South Africa now in terms of their HIV and TB response, and that really gives me hope. Because there are days where I worry that we're so far off the SDG targets and we're never going to get the resources and the attention to meet them, the Sustainable Development Goal targets, by 2030. But then there are these moments of hope that I see in communities and here in our own country as well. And and I think together, all those efforts together will actually be the power that we need to continue that progress and meet the goals of 2030, and the work continues beyond 2030. So that gives me hope, Joanne. I think there's a lot to do, but when you see those moments of progress, when you see Biden saying that he's going to host a summit, or the $6 billion figure in the budget, that gives me hope, because I know that those moments will lead to greater change, and that change doesn't just happen like that. It comes from grassroots, and that's the work that you all are doing.
Yep. Yeah, absolutely. No, thanks. Thanks so much on that. And I believe it too. Like it's not an easy path, but I think we also have an enormous opportunity here. So maybe a couple of final questions, maybe for some quick responses. One, I think the grassroots appreciated your feedback about why it matters. So one question is like any tips about what would get through at this moment, in talking about the Global Fund and its critical role. And so any tips about kind of working with allies on the Hill. And then, a second question, what other countries beyond the G7 should we even be looking to our members of Congress to reach out to, seeing if they have relationships. And then if we have time, like just a final briefly, you also, are deeply engaged on PEPFAR. Could you just say a word or two about how PEPFAR and the Global Fund are so interlinked and important to each other for delivering on this work?
Oh, sure, absolutely. By the way, should I be looking at the chat too, or are you reading?
No,
the chat
we're just pulling out the questions, so as we
sweet.
can. Yeah.
So let's do those one by one, and let me know if I missed something. But so in terms of the donor engagement, yeah, so the G7 makes up over, I think, 75–80% of the total funding. So that's why we keep saying G7, and that's why it's so important that, and the US is part of that G7, of course. And by the way, remember that the president's budget is a proposal, right? And so the work continues now with Congress to ensure that that work actually gets into the appropriations bill, and then it gets signed into law eventually. All that work is just starting now. And that's where your help is going to be needed at every step of the way. So while we're celebrating the president's budget request, remember that that is just the first part of a multi-step process to drive that amount. And so, but beyond the G7 nations, the Global Fund has a lot of targets that they're trying to activate with regards to medium income countries like Brazil, India. I don't have the full list, but there are a lot. I mean, there are a lot of donors make up the next 15 to 20%. And Luxembourg recently announced their contribution to the G7. That was really important. And so there's there's also a lot of work happening to highlight the role of the implementing countries themselves. And I think it's important that we highlight that. Remember, when the Global Fund launched its replenishment campaign earlier this year, it was 5 African nations that launched what they call the preparatory meeting, and telling the story of the implementing work that's happening in leadership with these implementing countries. And by the way, many of them are also making financial contributions to the fund. I think that's a really important story to continue to highlight, even while they're mobilizing domestic resources themselves for the health response in their own country. So that's what I'd say in terms of trying to highlight and focus beyond the G7. In terms of the Global Fund and PEPFAR work, I saw it firsthand when I was in South Africa. As I said, that the Global Fund was just extending its 3-year contract, and there's a synergistic effort between these initiatives. Like, for example, in South Africa, again, only because this is fresh in my mind, the PEPFAR program is working in complementary ways with the Global Fund in terms of the community-led monitoring, PrEP, and expanding HIV prevention. There are communities that the Global Fund supports in terms of coverage, and then the other provinces are covered by PEPFAR, and it's really synergistic, and that's happening across many different countries. But together, the impact is greater than any one entity can have, right? And so it goes hand in hand, and so that work. And that's a good story to also share with donors and with legislators and with lawmakers, because they want to see that their funding is being leveraged by other donors, or their resources that they're mobilizing are being magnified for impact. And that's what the synergistic work of the Global Fund and PEPFAR are doing in different countries. So that story is really important. Thanks for highlighting it. If I could just put in a plug for the PEPFAR program itself, we're very excited that Dr. John Nkengazong was recently confirmed by the Senate. He's going to be sworn in this month, and we're excited by calling him Ambassador Nkengazong within a couple of weeks. And that PEPFAR program, which is the bilateral HIV program that the United States supports, is also going to be doing some really exciting work around its 20th anniversary next year, and then the reauthorization work. And I know that results and many of you have been instrumental in driving support for PEPFAR over the last 19 years, and for that we're grateful. And if it wasn't for that support, there's no guarantee that these programs continue to be reauthorized or funded. As I said earlier, we can't take any of it for granted. Look at so much work and need there is around the world, and even in our own country. So that's why the work that you all are doing is so important. There was a third question, Joanne, and I'm sorry that now I'm blanking.
Yeah, and we're maybe just a minute on this. I think people are asking, like, it's great to have you here, and any thoughts, tips about what would matter to the Hill on this? And you've already laid out a lot of that, including just the kind of synergy and the leveraging of Global Fund and PEPFAR, but just any final things you would say about, as people are doing remote meetings, but also as some of our folks are coming to DC in a week.
When members of the Congress who have when I was a staffer, I worked on like 18 issues. Okay, each one of those issues were important to the congressman, and there was another staffer who worked on 12 other issues or 20 other issues, and so when members of Congress who are, remember, mostly dealing with domestic issues, and because that's the community that they're serving, that is the they're not on the Foreign Affairs Committee or the Foreign Relations Committee, so to speak. And that's only a really small subset of members of Congress. They're not focused on international and global issues. But so when they hear from constituents that say, I care about the Global Fund to fight HIV, TB, and malaria. I care about health system strengthening in Africa. I want to support pandemic preparedness. These messages are very powerful, because then members of Congress who are, if they may not be oriented or exposed to these issues, when 20 letters come in on this, or 2 phone calls even, a member of Congress pays attention, because then they see that there's a constituency that they need to respond to. So it really is back to basics in terms of messaging, Joanne. It doesn't have to be that complicated. I think they just need to know that, and this is not just members of Congress, all decision makers, lawmakers, stakeholders, the G7 leaders, they need to know that there's a constituency that is still committed to fighting HIV, that is still committed to finishing the job on TB, and still committed to malaria. These issues have been around for a long time. And so there's a tendency for people to say, can we move on to something else? And we all know that answer is no, can't.
It's great. It's great, Gerard. Thank you. Thank you so much. Thanks for being with us on a Saturday, rushing to a hotel room. I'm not even quite sure where you are, but to catch, to be able to be on this panel, and especially just for all of your leadership over time. And just want to say that on behalf of all of us in the US and around the world, we really are committed to partnering with you to reach that full 18 billion. So just really grateful. Thanks.
Happy to join results, and thank you all for what you all are doing, and look forward to continuing to work. Happy to come back anytime you all will have me. So thank you, Joanne. Thanks to all of
you. Thanks so much. Thanks.
Right. Okay.
Great. So now as we turn to our next panel, the second half of this session, I'm really excited. You heard Gerard saying, I think very clearly, in many ways, talking about the Global Fund partnership and how we need other donors to step up and match the US and reach the full 18 billion. But then in actually creating the impact, and also in, frankly, some of the most important advocacy and leadership to also build support for the fund, but especially for delivery, its partners in countries and communities around the world that are doing this. And, I was on a call with our Action Advocacy Partnership just on Thursday, a couple of days ago, and we were strategizing together on the Global Fund replenishment. And I was just so inspired to hear the work underway. The team in Cote d'Ivoire talked about a new strategy to get mayors across the country speaking out for the Global Fund. In Australia, I hope they're all sleeping right now, but we heard about their own first 100 days campaign coming right after the elections to reach new members of parliament about the Global Fund. And now I'm really excited to have 3 other leaders from this partnership here today tuning in from Lusaka, but I think, Carol, you might still be in Berlin on international travel, but from Lusaka, normally Nairobi and Ottawa. And so I'm just going to introduce our panelists, and then I'll take some opening questions, and then we can get some questions for you all. So first, such a pleasure to welcome Carol Nawina-Katenga. Carol is Executive Director, many of you know her, of the Community Initiative for Tuberculosis, HIV, and Malaria, CETAM Plus, in Zambia, which is a patient-led organization. Carol is a longtime friend, and she is an extraordinary advocate regionally and globally, mobilizing directly affected communities to advocate for policy change, again, nationally, regionally, and around the world. She's sat on the board of the Global Fund and many other institutions, and including now she's representing affected communities on the board of the Stop TB Partnership, and has been such a champion in this work for decades. Next, we're going to have Sam McCow, who is a communications expert. He's focused on health financing and research and development advocacy. And as you'll hear, Sam's done remarkable work mobilizing national and regional policymakers for the Global Fund. He's a policy and advocacy officer at Wacky Health, which has staff in Nairobi, Addis, and Cape Town, And Sam and colleagues at WACI are leading regional advocacy on health with national governments, the African Union, and many global partners. And finally, I'm so thrilled to have Chris Dendies with us, who is Executive Director of Results Canada. Chris is also a dear friend and just a leader on advocacy policy. She's worked the Parliament and with the Canadian government. She's on the executive team of Nutrition International. And she is a real highly effective and passionate advocate on these issues. She sits on the board of Partners in Health in Canada and served on many other boards. And Chris and the team at Results Canada is now working with grassroots across Canada to secure a bold pledge for the Global Fund from Prime Minister Trudeau at the International AIDS Conference in Montreal next month. So welcome, everyone. It's great to have you. And maybe if we could start, Carol, if you could kick us off, maybe starting with the really big picture. You know, you've been leading this work through years of radical change. Can you share briefly how you've seen things change in the last 2 decades, especially through the Global Fund and community-led advocacy, and then what's needed now?
Thank you, Joanne, and welcome everybody. So I think what I'll start with is what I've seen is more of the diplomatic voice from the Global Fund. This has increased the attention of policymakers around the world to sit around the table with communities affected by the diseases. And this has given a voice, communities a voice to include their priorities in the Global Fund grant. For example, here I want to talk about the meaningful engagement of civil society and communities in the writing processes of this grant, as well as being part of the national strategic plans, the health national strategic plans. This is a requirement by the Global Fund, which means governments are forced to include a civil society, because if communities are not there, then their grants or their proposals will not be looked at. The other part is where we still have going on civil society being also principal recipients of the Global Fund money, and also communities being sub-recipients and sub-recipients. So at the same time, being recipients of the money, we are also the people who can also, receive money. At global level, we still have our work around the table as board members in the Global Fund. I think, like Joanne said, being board members representing communities, we have a developing country NGO and developed and developing country NGO. So you're around the table and you're able to talk about your issues and not having just somebody out there speaking for you. Again, the other part is also the provision of technical support and capacities through the CRG, the Community Rights and Gender Strategic Initiative, which supports communities to have information and knowledge in order to engage. Because for you to be able to engage at that level, you need to have that kind of information, and Global Fund support provides that. So this support, some of the support, for example, I've been doing a lot of TB work now, comes through the challenge facility for civil society through the Stop TB partnership. And this has strengthened this sector. For those who have been around, we know that HIV has had very strong activism and civil society are working around them. It's been difficult for TB, but now because of the Global Fund, again, through the strategic initiative, that has made it easy for people to work. A lot of the community-based organizations that work in TB, HIV, and malaria, again, for example, even CITAM, our seed funding was from Global Fund. We were supported and capacity built by Global Fund, and that's why we are still here now. I think the last one I'll talk about now is more around now the community-led monitoring. Initially, we always used to say it was very difficult for civil society to show the kind of work that we are doing. Advocacy is very difficult to measure. But now through the community-led monitoring, there's the ability to invest in data for evidence and advocacy. So around the community-led monitoring, these are mechanisms that, depending on the specific objectives of the monitoring, service users, the service users and their communities, we gather quantitative, qualitative data and observations to assess the availability, accessibility, and acceptability, equity, and quality of service that we receive. And then we use that same information to hold our service providers and decision makers accountable, which is something that was not there before. So those are the changes that I've noticed, that things are changing. I think we are getting a bit more engaged and being able to hold the government more accountable and doing work ourselves. than just working through other maybe international organizations.
Yeah, thanks so much, Carol. And I mean, for your explicit leadership in so much of this, but also the points you made, I think are really important as we talk about the importance of the Global Fund, you know, the uniqueness of its structures, the way it's allowing, but of course, civil society then leading and communities leading on this kind of community-led accountability that is so critical in some of the other pieces, but really important, I think, for also understanding the value of this partnership and mechanism and, you know, and what we have to continue to fight for. Sam, now, and then I'll come back with more questions as well, but then Sam, a question for you. You know, earlier I gave a bit of a sneak preview of the work of the Torch Caravan that you and the team at Wacky Health and many partners that you all organized and many partners participated in. It was really an astonishing undertaking in so many countries. Can you tell us a bit more about the caravan, you know, how it unfolded, what it achieved?
Right. Thank you, Joanne, and good evening from Nairobi. And thank you for this opportunity. The Torch Caravan for us was an incredible journey, a 20-country journey within 6 months that started in Cape Town, South Africa, and traveled from Southern Africa into Eastern Africa, Central Africa, Western Africa, then into Northern Africa, where the last country was Egypt, and the journey ended in Cairo, but the torch was brought back to South Africa. I think it's important to note that the journey was also very important and symbolic to the people who participated in it, because it started from the first clinic that ever dispensed a Global Fund medication for people who needed it. The journey was largely brought together and successful because of civil society. We had civil society in all these countries able to convene communities, members of parliament, implementing partners and donors. We were able to have all the stakeholders that would normally engage within the Global Fund participate within the Torch Caravan. And the most important thing and the most important thing that I took away from it is that everyone had something to say, from the government to the civil society, to young people, to the communities. Everyone had something to say. So as we were celebrating the 20th anniversary of the Global Fund and the impact it has had on millions of lives in Africa, then we were also preparing for the 7th replenishment. So it was a good moment to bring civil society together. It was a good moment to celebrate the wins that we get with the Global Fund. And it was a good moment to amplify the voices that normally would not be heard when we are talking about financing and investment.
Thanks, Sam. Thanks so much. And again, it was just incredibly inspiring, and we were thrilled to be able to also work with you to have that torch, you know, also brought to the, you know, symbolically to the U.S. But really amazing organizing work that you did. And we'll come back again for our next question. But now turning to you, Chris. Very specifically in this moment, like you and your team and the grassroots network in Canada, you all just had a major advocacy push last week, you know, getting Canada to step up its support for the Global Fund. You know, would love to hear just, you know, briefly from you about like, what was that like? You know, what happened? You know, what have you said? Like, what case have you made to build this, you know, including what are some of the challenges and how this fits into a kind of wider global strategy? But we'd love to hear about the Advocacy Week and the push that y'all are doing.
Sure, thank you, Joe. And maybe I'll start just by sending love and a shout out to the real leader of so much of our work on the Global Fund in Canada, Robin Waite on my team, who has been struck with COVID. So I'm a bit of a poor substitute, but having said that, thrilled to be here with my Results family and my Action family from around the world. Yeah, we're on the tail end of an incredibly inspiring, powerful week of action, where we literally, our advocates literally pushed open those, well, I guess metaphoric big oak doors that you talked about at the beginning of the conference, Joe. So we had about 100 advocates, not just results advocates, but we also joined up with some civil society partner organizations like One and Global Citizen, who we work closely with up here, and also a number of different sort of civil society organizations that have an interest in the Global Fund. So there's about 100 of us that literally took the hill. I mean, we met with parliamentarians and senators. I think we met with well over 50 of them in meetings throughout the week. And we went into those meetings really prepared, tailored our messages, had our concrete ask, which is a bold ask. 30% increase of Canada's pledge to the Global Fund, which is about $1.2 billion. I don't know if that's like $80 American, but it's still a lot of money. And it's also probably, when I thought about it, when we ask our volunteers to be bold, it's probably going to be the single largest investment that Canada will have made in a multilateral institution outside of, IDA replenishments. So it's a pretty significant ask, and I think the times sort of call for that. But I just want to sort of say that while the week was incredibly powerful, there's going to be lots of follow-up, and there was lots of prep that went into it, and lots of heavy lifting on the part of our team who coordinated it. Advocacy doesn't start or end with a single MP meeting. It doesn't start or end with a single letter to the editor. All of those pieces and ingredients are important, but we've been lining up what I call the dominoes for months. We've focused our grassroots actions month on month since May, but also actually I would say even going back to World TB Day in March, where our volunteers had 40 monuments lit up in red across the country to draw attention to the TB crisis. And we had an event with the minister. We were talking about the Global Fund even then. So, those actions over months. In addition, we have some really innovative stuff happening. We're allying with the HIV/AIDS community in Canada, and it's Pride Month here. So we're going to Toronto. We're bringing a whole bunch of people. We're going to march on the parade in solidarity, but also activate that community and work with them, all in the lead up to the AIDS conference that's going to, as you said, take place in Montreal at the end of July. And then in addition to that, just working with partners globally. I mean, I think some of our action partners in Kenya and elsewhere are reaching out to Canadian embassies to let them know that it matters. So we're doing that sort of that grassroots to global advocacy, and again, working with your team, Joe, to ensure that when President Biden makes a phone call to Prime Minister Trudeau, that he's holding his feet to the fire and ensuring that Canada actually steps up and pledges big, because the importance of Canada's pledge, which we've been kind of framing to the parliamentarians that we're meeting with, Joe, is that the AIDS conference will be the first G7 sort of pledge, we think, in the lead up to the summit that is not really taking place till the end of September. So it's either going to set the bar really high and meet that 30% increase, or it's going to dig a trench. So the stakes are really high, I think, in Canada right now, and that's why we're putting so much emphasis and effort and attention on this.
Thanks so much, Chris, and really inspiring to hear what you mobilized, and also what you mobilized on World TB Day and all of it, and and knowing that it's still a challenge, but it was a really good reminder. And maybe I didn't even say that enough in my opening, how much of a step this is. We could see even more than 18 billion, and we could use it, but it is a huge, it is a huge global, it's bold and it's ambitious, and we have to deliver on it, as a minimum to get the things we need. But it's a good reminder of how big a pledge this is for all of our governments, and why it matters so much. So I'm seeing a couple of questions, and one, Carol, maybe going back to you, but all of you should feel free to answer this. But a question coming from Gail in California, just noting how the COVID pandemic has set back the progress to eliminate TB, HIV, and malaria as global epidemics, and we know what a huge emergency it is. Carol, anything you would say briefly about what you've seen on the ground, what you've heard from colleagues on that, and just how you've been making the case to policymakers about why a stepped up response to this is so absolutely crucial, and particularly on TB, where we're seeing 1.5 million deaths a year.
So it is true that COVID has really taken us part, especially in TB. And as most of us maybe are aware, that a lot of the resources for TB were taken away, because then the similarities between TB and COVID. So you find that, I think when I look at all the health departments, the one that really suffered the most is the TB department, because even the diagnostic equipment, everything, all that was taken away and used for COVID. But then I think what we should do is really also try and ride onto the gains of COVID.
Yes.
We are in the TB industry, we're still crying to say we have this one vaccine. The world has shown us that the money is there, you know. But then why should we not sit back and say that people who had COVID are more important than people who have TB? So what we have to do is try and work on the gains of COVID and see if whatever mechanism that were used, ride on those and then push to make those changes. But the truth is, I think the question came up a lot of the gains that were made were really lost. And then, like I was saying, let's really push and just work on those gains and just keep asking the world, how did they do it for COVID? I mean, like you said now, Robin is not well. She could have had TB. So it's one person, you have COVID, you have TB. So why should the treatment be different for someone who had COVID and someone who had TB? Maybe just because TB affects mostly people who are poor, and then COVID affected even the countries, the donor countries where the money comes from. So it's really trying to find a middle ground on how we can, you know, use whatever the kind of mechanism they used against them to push for more support for TB, to bring it back to where it was. Because again, COVID is the one that really puts us back. I think, Joanne, maybe correct me if I'm wrong, it's about 12 years that
Yes.
it has taken us
Yes.
back for TB.
Yeah. No, thanks so much, Carol. And that really critical point about, you know, that COVID is been a huge hit, but it also showed us what's possible, right? You know, and that the resources are there. So I just, thanks for saying that so clearly. Sam, to you, I'd love to hear more. You know, the Torch Caravan was just one example, but the team at Wacky Health is also doing some other really interesting, unique, important cross-border regional advocacy. Can you just give us some other examples of what that looks like with communities, civil society, and MPs and beyond kind of working together around health budget advocacy and kind of other areas?
Yes, absolutely. When we look at our regional engagement, especially around the Global Fund work, I believe our first step is to ensure that everyone is on the same page. And this year we got very strong leadership from African leaders in South Africa, Kenya, the Democratic Republic of Congo, Senegal, and Rwanda, in terms of supporting the replenishment and also launching the investment case. So currently we are working closely with young people because there's a need to target specifically young people who carry this messaging forward, communities, and civil society, the media, and members of parliament. We're capacity building them to understand the investment case and to speak on the investment case. Also, we have inter-country peer learning, whereby we have civil society from different countries convening on a monthly basis to share experiences on the different levels of advocacy that they're having in the country. It's important to note that at the moment, the Global Fund was making mission visits to African countries. And so far, we've had mission visits in South Africa, Kenya, Rwanda, and Malawi. The mission visits have largely been very successful, being able to engage senior government officials, presidencies, communities, the country coordinating mechanisms, and more importantly, getting them to commit to pledging to the Global Fund and also to contributing to the Global Fund. And also looking forward to the replenishment, because we estimate that the replenishment will happen late September. We know that there are key moments between the launch of the investment case and the replenishment conference that we need to take advantage of. And these are different days, which started with World TB Day, World Malaria Day. This month, we have the Commonwealth Heads of Government meeting, where we will be convening with civil society to engage the different leadership. And we'll also be having a members of parliament roundtable at that particular forum. In July, we have the African Union Summit, which is incredibly important. We'll be having heads of government at that meeting. We'll be having important government officials at that meeting that will be looking to engage. And even as we go towards the replenishment conference, there are other moments that we'll be taking advantage of, such as the TICAD conference that will be held in Tunisia. So just bringing civil society together and also taking advantage of the key moments that are there to do the Global Fund advocacy and to make sure that we also increase domestic resources for health in our own countries and pledge to the Global Fund.
Great. Thanks so much, Sam. I mean, for all of that critical work in organizing, and also for that key point about, also leveraging, using these moments, not just to build support for the Global Fund, which is incredibly important, but leveraging leadership for increased domestic investment, co-investment too. And I think, important for people in donor markets who are also making the case to their governments to also understand that work that's happening as well. So thanks. Chris, to you, Results Canada and you all have been really successful historically in mobilizing support for the Global Fund, but also more recently in the COVID response and for other key global health mechanisms. Anything you want to share about lessons for donor advocacy in terms of how to push support donors to prioritize community-led responses to health and proven tools like the Global Fund? But you also, in particular, I think, make a really powerful case for how these institutions in this have to leverage each other and how the complementarity of them. So anything you'd want to say on that, we'd love to hear.
Thanks, Joe. On the on donor advocacy, I mean, I don't think there's really a magic formula or a secret sauce. It's kind of what we've been talking about. It's that steady drumbeat of powerful people, powerful citizens reaching out to decision makers, and being strategic and in all of the ways that Sam and Carol have articulated in terms of their own advocacy efforts. I mean, it's basically the same thing. It's coming up with a powerful ask. It's being prepared to respond to whatever questions that are going to get thrown at you, and in our case, often fiscal constraint, often the convergence of crises. I mean, our response to that is a bit of, it's advocating for the Global Fund in some ways I think of as a gift, because it is such a convergence of response to those converging crises, building health systems, addressing COVID, and being able to work in places like, the Ukraine in terms of emergency response, all of those sort of bits and pieces. But there's another part of it that maybe it's a bit of a departure from your question, but another part of it is just, wherever we are as advocates, there's something to be said to appeal to the humanity of the person that's sitting across the table from you that's going to be making the difference. And I've been struck recently, but just by the idea that, 20 years ago, the world came together around the deplorable fact that millions of people were dying needlessly, even though we had the tools to prevent those deaths and that suffering, needless suffering. And the Global Fund was born. It was it's the idea of it that's so powerful, that the world could come together, even in the face of big challenges, and come up with something that was really one of the biggest global health achievements that's ever kind of come into existence. And I think that this moment also, with so much need, that also points to the inspiration of the fact that we can do something. You talked about my being on the board of Partners in Health Canada, but Paul Farmer, I've been thinking about him too, who passed away not too long ago, who was a brilliant global health hero and just hero generally. And he said, the idea that some lives matter less is the root of all that is wrong with the world. And I'm continued to be struck by that. And I will say that some of the best meetings that I've had this week is appealing to that kind of sense of, we can be bold, we have the opportunity to be bold, and we should be bold. So it's just been, part of the donor advocacy, part of any advocacy is, when you're on the side of hope and solution, that's a pretty good vantage point from which to kind of make your case.
Yeah. Thanks so much for that, Chris. And I see a kind of maybe a closing question. We have a few more minutes, but for any final comments you would want to make, but also a question comment from Yannick Perdin in Florida. No matter what disease, healthcare is a human right and should be accessible to all. So, and a question about, can you talk about maybe briefly about health system strengthening and how the Global Fund could help? Maybe start with you, Carol, and then just ask folks, we've got maybe like 3 more minutes. Just anything you'd say just in closing. But Carol, maybe over to you about the Global Fund and its role in building out health systems.
The entire through the coming 2 days for different sessions and in different moments. And this obviously includes our 6 ministers of health board.
Hey, Kara. Oops.
From Nigeria will be with us as
Huh.
There must be a video playing somewhere.
Yeah, maybe something that's maybe a glitch or something. So yeah, maybe just opening it up then. So that question about the Global Fund, maybe very briefly for any of you that want to take it in its role in building out health systems, or just frankly, we've got a couple more minutes. Anything you'd say in 30, 60 seconds that you would want to close with to
and
your
are
partners.
actually the engine and the heart,
Okay.
and the ones that will keep us,
So I think.
Oops. Yeah, Carol, I think you have a video playing, so it's hard to hear you. I think they muted you. Maybe we'll go to Sam and then Chris, and then come back to Carol to close.
I think the role of the Global Fund in investing in health systems cannot be understated. We have seen how a pandemic can take us back 12 years in just under 2 years. So the investment in the Global Fund is incredibly important. This has been echoed by communities, people who are actually affected by this. This has been echoed by civil society. It's been echoed by governments. We can see how important it is. And for us, this year leading to the replenishment, the most important thing is that all our governments need to increase our investments in the Global Fund by 30%. This is to all donor countries and all implementing countries who are also donor countries, including countries like Kenya and South Africa. It's incredibly important that we match the contributions to the Global Fund domestically in order to ensure that should anything like COVID-19 happen again, then health systems are able to actually respond and save more lives.
Thanks. Thanks so much, Sam. Chris, over to you, and then we'll come back to Carol.
Yeah, I just want to, first of all, thank you for doing this and having this conversation, and just to say, I hope everybody on the call feels lit up and inspired by the advocacy that you're doing, as much as I feel lit up and inspired by all of you. And yeah, that we need to dream big, because when we do, big things are impossible, or big things are possible. And so look forward to a successful $18 billion replenishment in DC in the fall.
Thanks so much, Chris. Thanks so much. And Carol, back over to you. Let's see if we can get you to say a few words to close.
Thank you. Apologies about that.
No worries.
It was Luchika speaking. I don't know what happened. Yeah. So I think for me, all I'll say is, again, is to just encourage us, one, to really fight for a fully funded Global Fund. And also around COVID, again, to say with the Global Fund partnership, we know it contributes to an equitable health system. And like I said, without, I think, the support from Global Fund, I don't think COVID would have gotten the gains that it did, because the COVID rode on the existing health systems. For example, most of the like I said, in TB, the diagnostic use was the gene expert, the community volunteers that were used. Most of them were for the TB constituency, because then TB volunteers already knew how to mask, and they already knew how to do contact tracing. So if we could help COVID in that manner, we should also ride on the gains of COVID. Like I said, they've already showed us that the money is there, so let's use that, and also push to ensure that maybe we can also have an effective vaccine by 2025. It's something that we're pushing for as civil society. The other part I talked about, I think, as I end, is really looking at the flexibility in leveraging the existing resources in engaging the voices of civil society. Again, and also the improvements in the governance model that also needs to change with the inclusion of the focus, the Global Fund on the PPR, the pandemic prepared response. I think Sam said something about it. The work should go on. We should not always wait until something happens. Let's not wait for a pandemic, so that we can continue on the work that we are doing and ride on whatever we have that exists.
Thanks. Thanks so much. Thanks so much, Carol, and for that critical point. And just thank you to all three of you, and like all the work you represent for your teams and your partners in the country. incredibly grateful to work with you, and just a thank you to all the folks across our partnership and the Action Secretariat team and everyone that is doing this work day in and day out. And we will work together to get to that 18 billion because it's possible and because we have to. So thanks everyone for being part of the session.